So my name's Caitlin Knockert, and today I'm going to be demonstrating a blood transfusion. So first thing I'm going to be doing is I'm going to be performing hand hygiene. So we're going to review my physician's order sheet. So my patient has just been ordered a unit of packed red blood cells, so we'll just go through here. So I have my patient is a Treek, Jerry. The FIN is 261-824-375. So this order was made today now for 1 unit of packed red blood cells to be given over 2 hours. I'll just be making sure I have the physician's signature there, so that's all the information we need there. So at this point, I'm just going to be making sure I have a current and signed consent form. So it's current, it's signed, so we're good there. So at this point, I'm going to call a second nurse to come and do the blood checks with me. So they'll have the demographic sheet. I'm going to read off the record of transfusion. So we're going to get started. Our first check. So we have last name Atrique, A-T-R-I-Q-U-E. Yeah. First name Jerry, J-E-R-R-Y. The FIN is 261-824-375. So they're going to move on from the demographic sheet to the blood tag. And I'm going to stay with the record of transfusion. So second check. We have last name Atrique, so A-T-R-I-Q-U-E. And then first name Jerry, J-E-R-R-Y. The FIN is 261-824-375. The patient blood group is AB positive. The component blood group is AB positive, and those are compatible. The donation number is C051008900445, Y in a box. Okay, so that's it for that one. So now I'm gonna move on to the blood bag, and they're gonna keep the blood tag. Okay, so my product type is red blood cells. So the component, like the blood group here for the donor, is AB positive. The donation number is C051008900445, Y in a box. So I'm just checking to make sure it's not expired. I have the volume here is 358 mLs. So I'm just checking the bag for any abnormalities, any breaches in integrity, and there are none, so we're good there. So that was the third check we just did there. So now at this point I'm going to grab everything I need and we're going to head to the patient's bedside. So I'm just performing hand hygiene as I'm entering the patient's room. Before I would go, I would just also make sure to check the patient's labs, so making sure I understand the reason why the patient has been ordered blood. So let's say in this patient's case they have a hemoglobin of 60 and so they really need blood. They've been cross-matched, so they're good to go there, so that's why they're getting the blood transfusion. So I just performed hand hygiene as I'm entering the patient's room. So as I'm entering, I'm doing an entrance safety check, making sure the patient's not in any distress. I'm going to introduce myself. So my name is Caitlin Knockert. I'm going to be your student nurse today. So I'm just going to get the patient to verbally confirm their name. So I'm just letting them know I'm going to pull the sheet back here. We're going to look at their wristband. So we have my second nurse here. Second nurse will be doing the fourth check with the blood tag. And I'm getting the patient to state their name and spell it letter by letter, their first and last name, and they're going to state their date of birth. So I'm just checking that that matches their wristband, and it does. So now at this point, I'm going to read off their wristband, and they're going to check on the tag. So we have last name Atrique, so A-T-R-I-Q-U-E. First name Jerry, J-E-R-R-Y. The FIN is 261-824-375. Second nurse confirms that that's correct, and it is, so they're good to go now, and I'm going to get everything set up and ready to go. So first thing I want to start with is just educating the patient, so letting them know the reason why they're getting the blood here. So I'm letting them know that they have a very low number of red blood cells in their body. So they need blood to replenish the amount of cells that they have for like red blood cells, because they have a hemoglobin of 60. So if they understand, we would go into that. So now we're just going to go over what side effects might come with the blood. So we're just letting them know that sometimes people have reactions to the blood, so a transfusion reaction. So I'm just letting them know to watch out for any symptoms, like if they have itchiness, if they feel short of breath, if they feel hot, if they feel flushed, any of those kind of side effects, to let us know, because then we would stop the blood transfusion and we're going to give them normal saline then. Okay, so I'm asking the patient, so I know they already signed a written consent form, but just asking if they still consent to receiving the blood. They say that they do, so we're good there. So what I would be doing is I'd be taking a set of baseline vitals before we get started. So I'd be filling out my CVR form with the baseline vitals. So my vital sign protocol, I'm going to be doing it before we start the transfusion reaction. I'm going to do it after the first 15 minutes. And I'll be staying with the patient continuously for that first 15 minutes. After the 15 minutes, we're going to be doing vital signs 1 hour throughout the transfusion, at the end of the transfusion, and then 1 hour after. Okay, so that's all signed and we're good to go. Or not signed, but like prepped. Okay, and then I'm just noting the presence of my emergency normal saline line, so I've been making sure there's no bubbles, it's appropriately primed, and this is ready to go just in case there is a reaction where we have to stop the blood and we have to hook them up to the emergency normal saline line. So the patient's informed, I'm asking them if they have any questions, they don't, so we're gonna get started. So, doing hand hygiene again, and we're gonna start with our tubing now, we're just prepping our tubing.
And then finally, I also need to confirm that I have the correct diluted, so I have 100 ml of normal saline. And then for
Alright, so we're just taking
right date and time, it is due today,
that
it
out
is
of
now,
there.
and no one has signed for it yet, so I'm able to go ahead and continue this. At this point, I would have a second nurse.
So I'm just making sure to maintain aseptic technique. So we're gonna take that cap off. Whoop. Take that cap off.
So I'm going to go ahead and clean.
I would wipe them up there. I got a little bit of normal saline on them. Or actually, I'd be prepping this in the pharmacy or like in a separate room before bringing it to the patient's bedside. But okay, so that line's clamped. I'm just going to clamp this one as well.
My vial will go into my waste. So I'm going to lightly mix this, and I'm going to create a label for my
Okay.
bag here.
So what I'm going to do is I'm first going to pop this cap off, and I'm just making sure it stays clean so that I can still put it back on, or aseptic is what I mean. So I'm just going to open this tubing.
This is my vial. The volume is
So now there's just normal saline running through my line. So once there's no bubbles, I'm just going to clamp it off.
concentration is 0.9.
So I'll pop this cap back on. I'm just going to place that line up there for a second. So I'm just going to open this part, and we're just going to get the blood to prime. Past the filter.
And then I would have my second nurse sign this as well to ensure that they have also completed their second check. So here's my label.
Okay, and I'm just going to get all the air out of that filter. Okay, so I'm making sure that that filter is well filled up there. So I'm just going to leave that clamp open to the normal saline for a second. Okay, so that clamp's open, this one's open.
So now that my checks are complete, I can go to the bedside.
So we're just gonna pop this cap off.
So to the bedside,
Go.
I'm bringing
Again, I'm placing it so that I can put that cap back on.
a syringe to ensure that.
So we're just gonna run it out a little bit just so that there's no bubbles in that line.
So I'm entering my patient's room. I'm doing my
Okay, so there's no bubbles in here. So I'm just gonna clamp that again. We're gonna put the cap on.
nurse today. I'm here to give you an
Okay.
insulin infusion. The doctor has ordered it.
So that's good to go. So now I'm gonna perform hand hygiene again. We're gonna don my gloves because now I'm gonna be working with the blood and I don't want it to touch my skin.
With insulin, you might experience some side effects like hyperglycemia or low blood sugar. So if you start
So this line is clamped. I'm just gonna detach that. And I'm gonna aseptically attach it to my blood.
please let me know and I will come assess you immediately. It's really important that you let me know. Are you okay with this drug?
So just so you can see here.
And throughout this continuous infusion, I will be assessing your blood glucose and your vital signs often to ensure that we can get them within the
Okay, so I'm just making sure to aseptically attach that.
complete my first check.
All right, so now we're good. So I'm gonna hang my blood bag. So I'm gonna grab my line.
How's your name? Good, and what's your birthday?
So I'm just gonna pop this cap off again.
No?
Oop, there goes my cap.
Excellent. Guys, if you're between takes, just keep it talking 2 minutes, please.
So now for the blood, I'm just gonna let it prime. So I'm just giving it a squeeze and I'm just letting it run through. There we go. So I'm gonna just get the normal saline out of this line. So once I start seeing blood at the tip of this line, I'm gonna clamp it off again. Okay. That's clamped. So what I'm gonna do is I'm gonna use this cap from my normal saline line, or my flush.
Unfortunately, in the lab setting, our
Just like that, so that it's clamped and it's good there.
with saline.
So I'll just flush the patient's PIV first before putting it in the pump. I'm gonna put it in the pump first, but just so that I had a cap for my line there. So I'm gonna clean that port for 30 seconds. So 30 seconds has passed. I'm just gonna flush the line. I'd be making sure that there's no bubbles in here. There's just one little one. I thought I had them all out, but. Okay, so all the bubbles are out. So we're gonna attach that. I'm gonna unclamp the patient's line. We're just gonna give them a flush. Okay, and it's flushing well. I'm just making sure that that site isn't painful. It's okay. Okay, so now we're just gonna clamp that off again. And I'm just gonna let it sit there. I'll clean it again because I have an extra swab. So now we're just gonna place this into the pump. So I'm gonna go on primary. I'm gonna go change mode. I'm gonna go up to label line. I'm gonna select that. So I'm gonna go page down to the red blood cell. Okay, so now I'm gonna run it at 50 cc's per hour, just at a slow rate to start for the first 15 minutes. The volume in the bag that I have is 358 mLs. Okay, so I'm just gonna confirm that. What we're gonna do is open this line first before I confirm it. So I'm just gonna clamp this and I'm gonna place it in the pump. Okay, so it's in the pump. We're good there. So I'm happy with this. I've double checked it, confirming it. Okay, so like I said, I'm going to be staying with the patient for the first 15 minutes of the transfusion. So we're going to run it at 50 cc's. If the patient doesn't have any reaction to it, we're going to bump it up to 197 mLs per hour. And that'll get the blood to transfuse over the next 2 hours. Okay, so the patient's consented, they don't have any questions. What I'm going to do is I'm going to clean this line again. Okay, so clean that for 30 seconds. And I'm going to take off my cap there. And I'm going to attach it to the patient. Okay, I'm going to open up that clamp. So now we're going to start it. Okay. So now at this point, I would just be making sure all the clamps are open, that it's closed to my normal saline. So this is my normal saline. I'm making sure it's close to my normal saline. It's open to my blood. Just looking at making sure it's not clamped anywhere. It's running into the patient. So I'm just going to be checking for 3 drips in my chamber here. So it might just take a second for it to run, but I'll be checking for 3 drips, making sure that it's running, and it is. So then at this point, I'm just going to make sure to document on my CBR form. So I'd make sure I have 2 RN signatures that the blood is being given. So like I said, I'm going to follow through with my vital sign protocol. We'll do it after the 15 minutes, an hour throughout, at the end, and an hour after. Okay, so then after that, I'm just going to discard my gloves. I'm going to perform hand hygiene, and we're done.